Antimicrobial Stewardship, helping dairy farmers optimise antimicrobial usage. My name is Prof McDougall. I graduated as a veterinarian from Sydney University and after some years of practice undertook a PhD at the vet school at Massey University. I've had a 30-year career in cattle medicine, production and applied on-farm research. I'm a registered specialist in cattle reproduction with the Veterinary Council of New Zealand and have an appointment as an adjunct professor at the vet school at Massey. Cognosco, the research team I lead, is in the process of completing a 3-year study into antimicrobial usage and resistance in the dairy industry here in New Zealand. The research work that underpins much of this presentation has been funded by the Sustainable Farming Fund from the Ministry for Primary Industry in New Zealand, the Dairy Cattle Veterinarians of the New Zealand Veterinary Association, and by Dairy NZ. This presentation was developed for Agriculture Victoria as part of a wider project disseminating information about antimicrobial resistance as part of the Australian National Antimicrobial Resistance Strategy. This talk outlines a structured approach to good antimicrobial stewardship on farm and then outlines some examples of practical tools that may be of help in achieving improved stewardship. In cattle production systems, farmers do much of the frontline diagnosis and treatment of disease. So in any discussion about prudent usage and good stewardship of antibiotics, farmers need to be directly involved. So as veterinarians, if we wish to help farmers achieve better stewardship of antimicrobial usage, we need a structured approach. Such an approach is built around the plan, do, review process commonly used in management and that's been used in programs such as InCalf and Countdown Down Under. The first step is to get information on drug usage on farm. This can be obtained either by sales records from veterinary clinics and/or electronic or paper records on farm. From this data, drug usage can be calculated and benchmarked across farms. It's also important to understand the farmer's knowledge, attitudes, skills and aspiration, or CASA, around antibiotic use. In conjunction with drug use data, we need to look at disease incidence and current protocols for diagnosis and treatments of specific diseases. Having collected the data and benchmarked antimicrobial usage, gaps in recording of disease, drug use and training are often identified. Lack of clear case definition or thresholds for treatment commencement or completion are also often identified. Based on this gap analysis, a specific plan for the farm can be developed. This may include farm-specific goals around antibiotic usage, disease management control measures, development of standard operating procedures for specific disease diagnosis and treatment, as well as broader animal health plans. Improvements in prevention procedures such as improved biosecurity, hygiene, appropriate culling, and use of vaccines may be indicated. We at Cognosco have been working on introduction of antimicrobial action plans for farmers. To do this, we have been calculating drug use and benchmarking at farm level. We have also provided the farmers with some rationale as to why we're talking about antimicrobial usage and antimicrobial resistance, and we have talked to them about their perceptions of antimicrobial usage and risk of antimicrobial resistance. You can refer to the other talks I've prepared for Agriculture Victoria that cover these areas. This then leads to a review of current disease incidents, treatment protocols, and in some cases development of farm-specific standard operating procedures or SOPs for first and second choice antimicrobials. We then agreed to a small number of goals, 3 or so, around antimicrobial usage, and to have written specific, measurable, achievable, realistic and time-bound or SMART goals. And finally, we've monitored antimicrobial usage over time to see what has happened. As part of this process, we developed a form to capture the discussion around the antimicrobial usage management. On this form, we define the action or goal, define who is responsible and the timeline, and capture the completion date. A research study where such plans were developed for 40 farms resulted in a wide range of actions or goals being proposed. Herd owners and vets agreed to develop and use specific on-farm treatment protocols for common disease conditions, improve staff training around diagnosis, and develop appropriate drug choice and appropriate treatment and recording protocols. Other actions including collecting more milk samples for mastitis diagnosis to help inform treatment decisions and monitor if antimicrobial resistance changed. Other plans focused on improved mastitis management by implementing better teat spraying, identifying cows that have had multiple treatments for clinical mastitis, improving culling decision rules, introducing teat sealing of heifers, stopping the feeding of antibiotic waste milk to calves, and improving quality of on-farm water. Other actions included limitations on use of specific products such as oral calf antimicrobials, critically important antimicrobials such as third and fourth generation cephalosporins, fluoroquinolones and macrolides, and other disease control tactics such as use of calf scour vaccines, improved lameness protocols including lifting of all feet, better diagnostics and restriction of use of antibiotics only to those cases where infection is likely, improvements to races and assessment of trace element status to improve overall cow immunity. Using this approach, we have compared antimicrobial usage over 2 years amongst 80 herds that did or did not develop antimicrobial usage plans. We found herds that did not institute a plan actually increased antimicrobial usage from 1 year to the next, while those instituting a plan declined. Overall, this change approached significance at p equals 0.06. There are a number of tools that may help improve stewardship on farms, including decision trees for mastitis treatment, on-farm culture systems, and other decision support tools. We have evaluated an on-farm culture system using a selective media. This system involves a plate which has 4 quadrants. The first quadrant is a general blood agar, the second a gram-positive selector media, which includes indicator compounds that allow differentiation of Staph aureus, CNS and streptococci. The third is gram-negative selective media, which again has indicator compounds which allow differentiation of the E. coli from Klebsiella and Serratia. And finally, a selective media for other pathogens such as yeasts and fungi. In conjunction with the selective media, we developed a decision tree which allows farmers to make treatment decisions based on the culture results. In this protocol, cows that are systemically ill are treated immediately, but cows with mild to moderate signs of clinical mastitis have a milk sample collected and treatment is withheld for 24 hours. Where culture indicates either no growth or a coliform, treatment is withheld and the cow observed for a number of days. Where Staph aureus is identified, extended therapy with cloxacillin may be used, or if the cow is old or has multiple affected glands, the decision may be to dry quarters off or cull the cow. Finally, those quarters with streptococci, coagulase-negative staphs, or other infections were treated with narrow-spectrum penicillins. Use of this system on 7 herds resulted in an overall reduction in antimicrobial usage of approximately 20%, and this was consistent across the farms. Research studies show that bacteriological cure of clinical mastitis varies by the pathogen involved, the cow's age, and stage of lactation. Analysis of data from multiple studies was used to develop a decision support app. The app has 3 modules. The first calculates the likely cure rate of lactating cows with clinical mastitis. The second is designed to help farmers make a decision as to whether to continue treatment of a clinical case, and the third looks at likely response to dry cow therapy. Note that these decision support tools are for guidance only and should be used by herd owners while remaining in close contact with their veterinarian. By selecting the Clinical Mastitis module, a second screen appears with a series of drop-down boxes into which the age, the weeks in milk, position of the gland, that is, the front versus rear gland, and the bacterial species, if known, are entered. It then calculates the probability of cure. In this example, a 3-year-old cow that is 2 to 4 weeks in milk with an affected rear gland and infected with the streptococci has an 85% cure rate. In contrast, an older animal, later in lactation, and infected with Staph aureus may have a cure rate below 20%. Knowledge of these likely cure rates helps farmers and vets decide whether it's worth treating glands or looking at other options such as drying glands off or culling. A common question from farmers is as to whether they should continue treating a cow after the initial course of treatment, where there is some ongoing inflammation such as changes in milk or swelling of the gland. Analysis of a data set in which cows were assessed prior to treatment and 4, 14 and 21 days after treatment was used to develop a predictive model of likely probability of bacteriological cure. This model uses the age of the animal, days in milk at diagnosis, the change in RMT score from pre-treatment to day 4, and presence of heat in the affected gland on day 4. Given these inputs, the model calculates the likelihood of bacteriological cure. This data will aid decisions as to whether to continue the course of treatment or not. The outcome following dry cow therapy can also be modelled based on research studies. Given the age of the animal, history of clinical mastitis, and the maximum somatic cell count, the probability of the gland actually being infected at the time of drying off, the probability that the gland will be infected at next calving, the probability that the animal will have a case of clinical mastitis in the next lactation, and finally, the probability that the animal will have an elevated somatic cell count in the next lactation can be calculated. This app is available for free through the Play Store or for iPhones by searching for Bovine Mastitis Cure Calculator. It is beyond the scope and timeframe available of this presentation to go into detail about disease control programs more generally. However, the basic principles of reducing the risk of introduction of a new pathogen, that is, biosecurity, and limiting spread of pathogens within a herd by good infection control remain important. From a mastitis perspective, antimicrobial usage may be reduced by use of infusion of internal teat sealants into heifers prior to calving and into low-risk, low somatic cell count cows at the end of lactation. Internationally, there are a number of vaccines available to reduce the incidence or severity of mastitis, including J5 vaccines and more recently a combination vaccine against Staph aureus and E. coli. Immune function in the peripartum period may be improved by better transition feeding and management, as well as specific immune modulators. This presentation has demonstrated that antimicrobial usage can be modified on farm. This requires a holistic plan, do, review process. Use of SMART goals with clear accountabilities is required. However, it should be emphasised that simply reducing antimicrobial use without reducing disease incidence and prevalence may result in poor welfare outcomes. So drug usage needs to be assessed in the context of disease on the farm. Thank you for listening to this presentation.